Okay. So who wants to do the communication to start with? Anybody can try. Dr. Tanushree, you want to try?
Okay, sir.
Okay. So commonly asked scenarios.
Hello. No. Yeah.
So okay, so let me stress you about that we are starting our Diet 2 uh, course. So whoever is planning to take Diet 2 and also Diet 3 also can join. So we have experienced mentors. We have three more mentors with us. So we are taking each station with a proper approach with focus on priorities in each scenario with all the trips and tricks. And so it is an intensive session, almost a weekly 2 to 3 sessions we do the practice. So whoever is interested can join. We are happy to help. Okay. Okay. So
So along with this, are you having any intensive revision course for people like us who are applying for exam in the next?
yeah, doctor. So it's a combination actually because since it's going to be only 3 months, right? February, March, April, right?
Yeah.
So you should be ready. So it's going to be both practice as well as some introduction classes. Okay, so mainly the recall practices we'll be doing, and those who are new, extra introduction classes will be taking. Okay.
All in the same class?
Now, extra maybe we will add one extra intro class for them, and they can join the practice the remaining 2 days. Okay. So for those who are beginning the communication station, it is 9 minutes. So we have 6 minutes plus 3 minutes to organize your thoughts. So there will be a knock at 6 minutes. So two communication stations will be there. Okay. And outside you get at least 3 minutes to prepare. And there will be a scenario that will be pasted outside. So Dr. Tanushree, I will give you 3 minutes time so you can prepare for the scenario. Okay. So this is the scenario.
Take a minute, come and join, okay? So can I start? Can you put the timer?
You can start, doctor. 6 minutes plus 3 minutes.
Good morning. I'm Dr. Tanushree, one of the resident doctors here in this hospital.
Good morning, doctor.
Good morning. Am I talking to Mrs. Lisa, mother of Alice?
Yeah, doctor. Yeah, you can call me Lisa.
Okay. Lisa, is this the right time to talk to you?
Yeah, doctor. Yeah. How is Alice? Is everything fine?
Yeah, Alice is doing fine. But there's something else that I wanted to talk to you about. And so before we start, I would just like to ask if you want anyone else to be with you in our discussion.
No, doctor. My husband has gone outside. I'm fine. You can talk.
Okay, so how far have you been updated about Alice's condition?
Yeah, Dr. Alice, actually, she had a fever and she got admitted. And even they did some blood test. The culture has grown a bad bug, they said. And they needed to do a test, something in the back, some fluid test. I don't know the results. How has it come, doctor?
So that is precisely the matter that I want to talk to you. But before I start, I would like to apologize on behalf of my staff and the whole doctors looking after Alice. I wanted to tell you about this incident that has happened with Alice.
What?
Actually, what happened was like Alice's reports were mixed up with another baby whose report had actually come positive for the bug, but there was a mix up with the reports, and because of the mix up, we ended up doing the lumbar puncture, which you have said, that is taking the sample from the back. But
What, doctor? How could this happen, doctor? Are you serious?
I'm actually here to apologize to you for this, for what has happened. We really don't have any excuse for this mistake, and I would like to apologize once again for what has happened with your baby.
This is unbelievable, doctor. Who did this? Tell me, doctor, who did this? Let me make a complaint.
I wouldn't want to take names, but I would say it is a total failure of our system. It is like I won't be able to pinpoint who made the mistake, but I would like to collectively take responsibility for what has happened. And let me reassure you, we have taken this matter to the highest possible level of discussion. We have already filed a critical incident report, and we have also had a meeting where we discussed about such happenings so that it never recurs again.
But it's frustrating, doctor. You used to say that LP has the test which you had lot of side effects, the headache, and infection, and a lot of side effects are there. Plus, the medicine, sleeping medicines has side effects, you said. And all this was done unnecessarily for my baby because of some idiot's mistake.
I'm so sorry to say that it's a collective mistake on our end that Alice had to go through so much. I really have no words to say how sorry I am for what has happened. This should never have happened.
But this sorry is not, it's not going to help her, doctor. She's still on antibiotics. Is it really needed now?
Yes, we have reviewed her report, and she doesn't have any bugs growing on her culture report. And so, after reviewing her with my consultant, we will make a plan for her to discharge her. And one thing is that she's doing well now, and so we are planning to discharge her after due consultation with our consultant.
I don't trust your hospital, doctor. I lost trust. But I want to take my child to another hospital.
I can totally understand what you're going through. Had I been in your place, probably I would have also reacted like this. But at this stage, going to another hospital means your child will be again reevaluated, and again all the tests will be repeated on her. So, would you want that to happen again? So your baby will again go through all the pricks and tests. So
Are you going to prevent me? See, I'm totally upset, doctor. I want to take my child.
I don't want to. I cannot prevent you, and I don't want to force you also. But I would just like to request you to do the best what we can do for her. I can understand that a huge mistake was done, and which is really something that cannot be excused. And I apologize yet again on behalf of my team to you.
6 minutes. 6 minutes up, doctor. So how will you prevent this from happening again, doctor? I don't want other kids also to suffer like my kid.
Yes, what we have planned to do is we will use highlighters to highlight the names of the patient who will require investigation like lumbar puncture, and the reports that we receive from the microbiology department, that will be reviewed by series of doctors, first by the receiving doctor, then by the nurse, then again by the doctor who is going to perform the procedure. And so there will be different levels at which the checkings will be done. And after that, only the patient will be cleared for any procedure like this. And we have filed this critical incident report, and we will make sure that this kind of mishap never happens again.
Well, what? Why you didn't do before, doctor? Why you wait for some error to happen? You could have done this before itself, right?
Because this has never happened here, and so this has completely taken us aback at what happened. And we definitely are very uh, sorry for what has happened, and we reassure you that this is something that we don't want to repeat. And
But doctor, it's okay. But I want to complain, doctor. I want to complain.
I can
I'm
understand this is your right to complain, and if you still want to complain, I can direct you to the patient's license services, who will they will I can instruct a nurse to help you. But let me tell you, this can be done even at a later date, because you can still do it after after Alice is discharged. And but now let us see what we can do, what best we can do for Alice.
make sure that she's not suffering again, doctor. Please take care of her.
Yes, I will definitely take care of it, and um, I apologize yet again for what has happened.
Thank you, doctor.
Thank you so much for your time, for your patience and time. Thank you so much.
Thank you, Doctor. Okay, Doctor. So you had 10 seconds left. Okay, Dr. Tanushree, I think you have become totally trained with this. So how did you do?
Uh, like, could I have added anything else when you asked me, what are you going to do to see that this never happens again? I said we are going to install series of checks at every point. So
Yeah,
that is,
that's not, they expect you to give some solutions so that it can be prevented. Doesn't matter what you talk, it's just about giving some solution so that it doesn't happen again. So mostly like here blood cultures were swabbed, so maybe the double checking is important, and
yeah.
before releasing the reports, some consultant supervises it again, so make sure that it doesn't happen again.
To be very frank, this was a mistake done from the end of the microbiology department, or mistake on our part. It's not clear from the scenario whether the wrong
It's
reports
a
were
system
sent from
error. So basically, it's a
the
system error.
system error. Yeah, yeah.
The error could have happened. So that's what you have to say. So who did this? It's a system error. The error could have happened right from the sample collection, the place where it is entered, processed, analyzed. Finally, report was made. Finally, report was dispatched. So error could have happened at any point of time. We are looking into it, and we are taking it seriously, and we make sure that it doesn't happen again. So that's how it goes. Anybody else wants to give feedback, like any other suggestions? Those
Okay. All right. Thank you, Dr. Tanush. The very last thing at your third side of conclusion, every need to say that you need to revise what you just discussed with the uh, the mother trying
Return the
to.
washroom പോയി പ്രശ്നമുണ്ടോ?
Yes, sorry. Can you hear me well?
Couldn't get
a,
what you said. Couldn't get what you
bit,
said.
a bit louder.
Yes. What I said is, in conclusion, you still need to play back or report
Summarize.
back all what you just discussed.
Yeah, yeah.
Um,
I
so
think that
ma-
that's a valid point. What the doctor is saying is, at the end you didn't summarize. Actually, I closed it so that I gave you time to summarize. So you could have summarized
I
as.
was thinking whether this was the ideal situation where some summarization will be required, because the patient's mother was pretty pissed off and angry, and so I was thinking I had it in my mind, but I was just thinking
Actually, in
whether.
that time only, when emotions are flying, they don't take the whole conversation with them. So it's better to give them the summary,
Okay.
take home points, and apology again. So I think in most of the places you apologized, so that's good. Any other feedback? So it's a very valid point that we could have summarized. So it's a very important to put a summary at the end.
But sometimes, if certain situations arise when the situation somehow goes out of hand, or not able to, like if the patient, if the mother keeps on, like she keeps on saying, so can we just stop her and say, let me summarize, or something like that? Will that be an
That,
appropriate thing to
that's
do?
not, no, no. Sometimes it happens that you will not be able to complete the conversation. So all that is important is addressing the queries. So whatever the role player keeps on asking, if she has lot of queries, you have to address the queries. So don't rush to summarize. Many times, many candidates have said that I was not able to summarize, but still they got the full marks. So the conversation, there is no such thing that you have to finish within 9 minutes. Looking at your structure of how you are conversing, but once time is up, you still have time left. So summarize.
Okay, sir.
Okay. So anybody else wants to?
Good evening, sir. Can we add a line on as of now the child is stable?
Yeah. Yeah.
Can we reassure them?
Yeah. So I also kept that one point. So everyone are good in giving the good feedback. So that was
Yes.
good actually. So Dr. Tanushree, you did say, but maybe some more stressing on that. Even though the procedure was unwarranted, as you said, there were a lot of side effects, but the child tolerated the procedure well, and the child is at present doing well. So that reassurance is very important. So try to reassure them when something wrong has happened, some wrong medication has happened. At present, the child is doing well. So that reassurance is very important to the mother. So at least the anger part will come down. So wrong medication was given, wrong culture was done, wrong test was done. But at present, the child is doing well, and we are monitoring the child continuously. So if you have given some wrong, very commonly they talk about giving haloperidol for allopurinol. So even though the medication was wrong, but the child at present is doing well, and we are constantly monitoring the child for any side effects. So we expect these are the side effects. So we are monitoring, and if the drug level is possible, we have sent um, blood levels for this drug also. So we are monitoring that. And if you want, you can involve the specialist depending upon the scenario. Thank you, doctor.
Can you just share the scenario once? I'll just take a click of it.
Yeah, no issue, doctor. I will share you the PPT. No issues. Okay. Then, and any else? Anybody else? Any feedback? Okay. So I think one feedback is regarding the wordings. Otherwise, overall structure was good, Dr. Tanushree. Well, sometimes I felt like it's a huge mistake we did. At least don't commit yourself that you have done a huge mistake. A mistake has happened, and I apologize. So don't try to exaggerate your mistake. Okay. And how will you prevent this from happening? Actually, I felt a bit lengthy conversation was going on when you're talking about how will you prevent this from happening. So usually keep crisp conversations, and whenever you're going a bit lengthy, keep asking again and again, "Are you with me?" Okay. So those sort of things you can just tell, and maybe the critical incident report said no, so that can be brought. Usually, see, I'm going to complain, so at that place also you can tell. Usually I talk about giving an explanation like that. See, I'm going to complain. Suppose the mother says complaining is your right, and definitely, and I will guide you to the PALS, patient advice and liaison services. But let me tell you that even if you don't complain, we are taking it seriously. We have made a critical incident report. We will be doing an audit as to why it has happened and take steps that it doesn't happen again. So, this we will be doing even if you don't complain. But still, if you do want to complain, I will guide you to the PALS. So, this way, sometimes some examiners write straight away that you are not guiding the candidate to complain, how to complain. And sometimes they say you are encouraging the candidate role player to complain. So both ways you should be careful. So better use this way. So if only when the patient says I want to complain, then only you tell it is your right. I will guide you how to complain, how to lodge a complaint to the PALS services. But let me remind you that even if you don't complain, we are taking it seriously. We have raised a critical incident report. We will be making an audit of all the why it happened and take steps so that it doesn't happen again. This we will make sure we do even if you don't complain. So that message, I think there we can add. But overall, the structure was good. Maybe I will just revise you with what are all the points when it comes to error, medication error. So very often we have a sorry scenario versus a apology scenario. Sorry scenario is where something which we have not done. Well, apology scenario is when we have done something wrong, then you have to apologize. So do not keep saying here, I'm sorry. So here it's a apology scenario where you have to apologize. So they will see whether you are apologizing or not. And what they will be expecting is you to apologize at the earliest. You cannot be beating around the bushes for a long period and at the end you apologize. So don't do that. So try to apologize straight away. Straight away break that an error has happened. And I would like to apologize on behalf of the team. So I would like to apologize on behalf of my whole team. And who did this to my child? Even though you know very well that a nurse would have done, but still you have to protect your team. So it's always it's recommended to say that it at present it's difficult to say. It's because it's a system error. It's a system error. There are a number of factors that could have led to the error. It could begin from collection, labeling, then sending, then analyzing, then preparing the report, report dispatch. The number of areas are there. So it's not a single person whom is responsible. If she keeps again asking, we are looking into it. We are yet to confirm, and it's a system error. It's a team. We work as a team, so it's hard to point out to a single person. So that should be the message, and always try to distract them to the good things. Mostly, you will not be given a very serious scenario because you are an ST3 level resident. So they will not give you a scenario where wrong medication is given and the patient is about to die. So it will be just a scenario where a medication is wrongly given, but the child is being monitored, child is doing well. So that thing you have to tell. So the good news is he is doing well. We are monitoring him for all the possible side effects. We are doing the investigations. So what all the investigation you have to talk about that. And if needed, if there is a specific antidote, you can talk about the antidote. We'll be giving the antidote for that. And when they talk about, I want to go to another hospital, I think Dr. Tanushree told very well. So that we are the best hospital. We know about the child's condition well, and starting from scratch into another hospital is going to delay the things. And if still she keeps on persisting, then let the child stabilize. And I will arrange a meeting with the consultant for you to talk. Okay. Then how will you prevent from happening? I think we discussed that. And I want to complain that also we discussed. So you're going to guide to the pulse. But at the same time, try to coin that another point that we are also doing side by side, irrespective of whether you complained or not. We will be doing the audit. We will be finding out the reason why it happened, and we'll make sure that it doesn't happen again. So this is the whole summary. So start with empathy and acknowledge and be clear and direct. So directly say that there is a mix up. Don't keep on beating around. Then apologize sincerely and reassure that the child is doing well and what are the next steps you are doing about monitoring and all. And offer support. So whenever they want to about PALS, so try to guide them Okay, and commit to the improvement. Explain the steps that will be taken to prevent the future errors. So this is what the. Okay, doctor.
Sir,
So
there was a scenario which has come in the Hyderabad exams about an angry mother about giving the second dose of dexamethasone in a child with croup, something like that.
okay, we have to check actually, but template will be the same. So this is the same template. So how it happened?
But second dose of steroid in a child with croup is something that is not wrong. I guess it can be given.
No, it's how quickly you're giving. So maybe
Yeah.
one accident nurse would have given at 12 o'clock, and the next shift nurse would have given. We have to look into the full stem. Maybe the nurse would have given within another half an hour another dose. So usually we need 4 hours time na, for steroids. Usually we give gap. So here also the side effects will be minimal actually, but there will be certain side effects. So that we will be monitoring. So that apologize. So it's almost the same pattern for all the drug errors.
What side effects can we expect?
So
In this?
steroids, what all we check you tell doctor. So about the electrolyte imbalance, then blood
Mhm.
pressure, then sugar. This will be the major immediate effects.
Okay.
Okay, doctor.
Doctor, what are the difference of the sorry versus the apology scenario?
Yeah, this the sorry is something like when you are breaking some bad news. The child is supposed suffering from a cancer, leukemia. So there it's not our fault, but how do you break? You have to say sorry. So that's a sorry scenario. I'm sorry for what has happened to your child. So that is the sorry scenario. But
Okay.
apology is when we when we have committed an error. So there we have to apologize on behalf of the whole team. I would like to apologize. So that is very important. So they will see whether you are apologizing at least 3 times, one at the start, one in between, and one when you are summarizing, you have to say the apology.
Okay. Thank you, doctor.
Okay, so who wants to do the video? It's a very nice repeat. I think in the recent Hyderabad also the video came. We can try out. Anybody wants to do? Okay. Dr. Austin.
I can try if you.
Yeah, just try. Nothing to. Okay. So just it's all about learning. Okay. So video will be the reverse actually. So communication will be 6 minutes, then there will be a knock, and then there will be 3 minutes of final summary part. In video, you will have you are entering inside. You will get 3 minutes to watch the video. So you will be watching the video. Usually, it will be around 1 minute. Okay. So usually it will be around 1 minute video, or maybe a bit more or less. Sometimes it will have an audio, so you have to use the earphone. It will be clearly written that it has an audio, so you have to use your earphone. Then you can watch any number of times till the 3 minutes. Okay, and you can also prepare your answers for the questions. The examiner is not going to disturb you for that 3 minutes. So write down what all comes into your mind while preparing. Then the next 6 minutes will be with the examiner. So he will be discussing with you. Usually the questions will be set. So there will be not much changes. Usually it will be like, what are your observations? What else will you ask in the history? What else will you ask in the examination? Will you do in the examination? What's your differential diagnosis? And how are you going to go about your investigations? And how are you going to go about the management? And maybe extra some more. And many times, if it is in the guidelines, pediatric guidelines, the questions will be right from the guidelines. So you have to prepare from the guidelines if it is there in the guidelines, or else you have to prepare from maybe next if there is some nice guidelines or standard books, then that will be the third. But if it is there in the guidelines, pediatric guidelines, questions will be straight from the guidelines. Okay, okay, Dr. Osden. So you you are now outside. Okay.
Okay.
So not much information will be there. So you will be given 3 minutes to see this video. It doesn't have a sound. It is a 13-year-old adolescent girl presenting with injuries. You can view any number of times. So that's much only will be there. So there also you can try to think what all might be the possibilities when you have an adolescent girl with injuries. Okay. Okay. So shall we enter inside?
Yes, please.
Okay. So now you are entering the room. So this is the video station. So you can watch it for 3 minutes. Then we can start.
Okay.
Okay, doctor. So now you get 6 minutes time. So first question, what are your observations, doctor?
In video, I watched a video showing an extremity of the child. I'm not sure, but I think it's upper extremity, and there were hyperemic regions and some white patches, and also some blisters. They were oozing. So I thought if it's a burn injury or uh, a traumatic injury. Of course, I would like to take a full history and make a physical examination to see other parts of the body so that I can give a diagnosis.
Okay, doctor. So, what questions will you ask in the history?
I would like to take a full history about the social history of the child. The child is living with his family, with her family. And when did this happened? I mean, these signs and the symptoms, when they started, and what did they do for this? Did they see a doctor, and did they use any medications? Is this the first time she's having such kinds of problems? And are there any current illnesses or chronic conditions she's having and she's treated for? And also, anybody living in the family problem, the family conditions? Are there any other? Does she have other siblings? And his mother and father are together, living together in the family? And is she going to school, or is she working? Is there any safeguarding problems? Are there any, those are the things I would like to ask.
Okay, doctor. So, what will you examine, doctor?
First of all, I would like to make a full physical examination to whether the child is conscious, and does she have any problems with her head, any head injury, and any other skin problems, or in other parts of the body. And is she using her limbs adequate? I mean, both all her extremities. Maybe there is a fracture as well. So I would like to see the position and movement of all extremities, and also any bruises, or any on her face, any bruises, or any problems with her eyes, or her vision and hearing, and a full physical examination. I would like to make a full physical examination to see are there any problems of his body, of her body.
Okay, doctor. Okay. So, what's your differential diagnosis in mind, doctor?
Actually, she's an adolescent girl, but since there's a great part of a majority of part of her extremities affected, it doesn't look like, for example, an insect bite or an allergic reaction. It looks like a traumatic, non-traumatic injury.
Okay, so it's a non-traumatic injury. So
But of course, sorry, in the history, I should have asked about the living conditions of the child. Any burn? Any, for example, any burning happened at the school, or at home, or burn injuries. I should ask some questions about that.
okay. So it's a non-traumatic injury, one of your DD. Any other DD in mind, doctor?
It's traumatic burn injury.
Burns.
Something could have fallen, thrown. For example, hot water, hot shower, or something could have happened.
Okay, doctor. So how are you going to investigate this child?
Uh, uh, First of all, I would like to, because she's an adolescent girl, is she, if she is really competent, that is, if she is mature enough to give her decisions herself, I would like to talk her alone. And I would like to ask what happened. Was there any trauma before this thing happened? For example, as I mentioned before, any hot water or other boiling material touched her skin, and any other pain or bruising in other parts of her body. Um, and is this the first time happening, or this happened before? Um,
How do you want to manage this child?
uh, if I think that it's non-traumatic injury, I want to involve also community pediatrician and my consultant. Just we will first of all make a full examination of the child to see are there any other problems in her body, any including other abuse features. And then if this is the case, I mean, if this is a non-accidental injury, then the social service will be involved also to make safeguarding of the child. And then we will deal with, of course, who did this and who is the responsible person. And then the legal problem, I think legal solutions will appear.
So most probably, who would have done, doctor?
Family within the family.
Thank you, doctor. Thank you. Time up.
Sorry, it's a very strange scenario for me, so I couldn't manage good. Sorry, but I'm learning. Thank you.
Actually, this scenario came now only. So
Oh, sorry, sorry. Thanks a lot.
Hyderabad it came. Thank you, doctor. Thank you. So a lot of thrilling, no, so a lot of guesswork, no. So many have written psychological condition, sunburn, one of the DD, fungal infection, cigarette burns. Yeah. So a good number of DDs, right? So Austin, how you did? So you're better?
Don't think so. But
I think see, the major crux, there is something called crux of MRCPCH, something which you should not miss. I think the safeguarding. So those parts, I think you did touch upon the social history. So those things are very crucial in this scenario. How is the family, that all. But the twist in the story is who might have harmed. Actually, she herself might have harmed. So that's the story.
oh, really.
Self harm. Okay. So I think everyone has put in the message also. It's a dermatitis artifacta.
Hmm.
So dermatitis artifacta, where the person himself creates lesions, fabricated create lesions, so that it resembles like a dermatological condition.
Should we make a health assessment?
Yeah, adolescent, when it comes to the history, hits assessment. Actually, you told all the parts, actually the family part and all, but you have to mention in an adolescent history, heads assessment is a must. So what will you ask in the history? You have to talk about the heads assessment, and maybe a bit faster, because we crossed 6 minutes plus. So you have to be a bit fast while you are talking. Okay. And what else? Anybody else wants to give feedback? Okay. Tanushree, you want to give any feedback? Okay, so if you want to describe the lesion, actually, when you look at the lesions, no? So they are bizarre geometric shapes. So usually dermatitis atipica will be a bizarre geometric shapes. So here it is not of a specific pattern actually. Sorry, voice is a bit low. Sorry. So it's not a specific pattern of injury. So the shapes will be bizarre. So here it's like circular but of different sizes. So with bizarre edges. So when there is a abnormal geometric shapes, so that will be the description. And many are hypopigmented lesions, plus 3 or 4 new ulcers were there, or new ulcers were there. So probably the previous were healed lesions. So that is the thing. And the distribution were in the easily accessible areas. So if you look now, so it is all in the, even in the forearm it was not there. All in the extensor aspect alone it was there. It was not in the forearm. So the definition wise, they are of abnormal shapes that, and in easily accessible areas, and different stages of healing. And when you take the history, there will be furthermore distribution in the other areas like face, chest. So those all areas you have to talk about. Okay. And some suggestion, what were in the suggestions? Yeah, deliberate dermatillomania, delusional parasitosis, accidental injury. Those are all very good suggestions for DD. And without the outside clue of injury, DD could be much more. Yeah, without the outside clue of injury, yeah, DD we can keep a number of DDs. Okay. But important clue is the adolescent. Once it comes to adolescent, when you have dealing with injuries, so either it's a self harm, dermatitis artifacta, so those things you have to keep in mind. And so whenever a video station comes, you write down your differential diagnosis. So you are there 3 minutes, you are looking at the video station. Don't keep on looking the video again and again. So watch once or twice, within 1.5 minutes, make an impression. Try to write down all your DDs in the paper. So you will be given a paper. So write down all your important differential diagnosis. So whatever you have kept, I think a lot of differentials are coming. So what core important DDs will be, one is either she herself had done, so it's a self-inflicted injury, dermatitis artifacta, so that one. Or it could be any other person harming, so it's a non-accidental injury, so that will be the second core. And the third will be, it's a real dermatological lesion. So it could be uh, it could be an eczema, it could be a contact dermatitis. So it's all in the DD, although the possibility is less, but it could be a DD. So it could be a dermatological lesion, proper dermatological lesion like contact dermatitis or atopic eczema, or a drug reaction. Whenever you have a skin lesion, your DD drug reaction should be part of it. Then burns, I think, as she said, it could be burns. Even these could be cigarette burns, and those could be healed burns, or any other instrument could have been used to cause the injury. Okay. So the important DDs are the burns, then self-harm, dermatitis artifacta, and non-accidental injury, and real skin lesions like eczema and contact dermatitis, and drug reactions. So these are the important thing, and other options which others have mentioned you can take. And what will you ask in the history? Okay, what it's written. So in clinical station, while introducing the patient and asking screening question and all, do we speak in English or the local language? Achha, sorry, it's unrelated to that. Patient and asking screening and all, do we speak in? See, when you are talking to the patient, you have to talk in a language which they understand. If you know the language, it's better to talk that. If you don't know the language, then at least learn certain one or two phrases so that you interact with the patient. The patient should understand whenever you're talking. So that is the important thing. Okay, when it comes to the history, how you are going to go about. So now you try to ask one question related to the DD. So whatever is in your DD, try to ask questions related to the DD. So whenever any condition, so what is the onset, what is the course, what is the duration, so that will be there. What is the aggravating factor, relieving factor? So those all you are going to ask in the history. But I think here what is more important, as we discussed already, the heads is important. So how is the home? How is the education? How is his activities? How is his interaction with friends? Okay, I think so. Those heads is very important. Okay, then ask about in history. See, now you are in the history, so you have to ask about the skin lesions. So where else are the skin lesions? So the distribution. So where else are the skin lesions? What are the associated factors with the skin lesions? Are there any itching? Are there any pain and oozing? So these are all you are going to ask in the history related to the skin lesions. Then very important question is, you are going to confront the patient. How did this happen? How did this happen? You are going to confront this. And is she accepting that it is self injury or not? Usually they will give a fabricated story. So you have to confront her. How did this happen? Are they telling the right thing, or they will tell some, like, just like bizarre shapes, they will give some bizarre story as to how it has happened. So just think about that. Then make a note about what is happening in the family, family history, neglect, abuse, family conflict. So those all are very important. Then what is happening in her mind, the psychological issues that is going on, any past history of self harm that is going on. So those all you are going to ask them. Then past history, what has any medical illness, whether she is having some chronic illness, she is depressed. So those things all you can ask. Then what are you going to do in the examination? So again, it's going to be the vitals. So vitals, ABC, uh, anthropometry, then examination of the rash. So now you have to going to examine the rash, where all it is distributed, and description of the whether it is infected or not. So I think those things you can ask. Then the nature of the rash, what shape it is. Okay, so these things you have to ask. And when you are examining, look into the behavior, whether the child is showing any reluctance, whether the child is not allowing you to examine. And most important, as Austin said, you have to screen for other injuries. So once injury, this is you are suspecting injury, what happened to the other injuries? So you are looking for other injuries. How is her behavior? So you do a psychiatric assessment here, or you can bring in the psychiatrist to assess the psychiatry part. Okay, so and you try to look for other evidence of skin lesions, whether any silvery scales are there or not, any purpura lichenified plaques are there or not. So related to the dermatology, core dermatology, you have to look and then give a DD. So what's your DD? Then the examiner will say, then what's your topmost differential? I would like to feel that it is a self harm. Why do you think it is self harm? Because these are all in the accessible areas. So wherever it is in the, had it been harm done by someone else, it could be a random place. It could be in any area, but it is in the accessible areas. So that's why I would like to think as self harm as the thing. Then how are you going to investigate? So here investigation not much. If it is dermatitis artifacta, maybe to rule out the infections, whether it is infected or not, we can go for blood test, CBC, ESR, swab, and a skin biopsy. If you are confused with some skin lesions, then only skin biopsy can be done. Otherwise, not much investigations are needed in dermatology, dermatitis artifacta. Then comes the treatment. So, who are all the multidisciplinary team? So, you have to be very fast in bringing the multidisciplinary team, where the CAMHS are very important. So, the child and adolescent mental health services, social worker, dermatologist. So, bring the multidisciplinary team, talk about the wound care, then the psychiatry component. So it could be cognitive behavioral therapy, some family therapy if there is family conflict going on, then supportive psychotherapy. Then if the child is too much depressed, maybe you have to give also some antidepressants. So these are, and one more important, if you say, I think they will be very happy. If there is a tendency to suicide risk, I would like to admit the child. So I think that is a very important valid point. If you tell, they will be happy. Okay. Okay, any doubts, or we'll move on to the development part? Okay, no. Before going to the development, volunteers, please. Who wants to try development?
Shall I try development?
Yeah, doctor. Yeah.
Thank you.
So can I try?
Maybe we will split up. Okay, Tanushree and Shaima can do. Shaima, you want to do assessment or history? But
Anything. I can teach the history and doctor can do the assessment.
yeah, so you can do the history part, then Shaima. So
Hmm?
Tanushree can do the assessment part. Okay.
Yeah, I will do the history part. Yeah.
So I'll do the assessment.
Yes, please.
Okay.
Thank you.
Okay. So this is the scenario, Shaima. You can take 3 minutes of time to prepare yourself.
Okay.
Right, so I think these are the few things which I just want. Okay, now, please, now it's your turn.
Okay, before going on to the development, I would like to tell the timings. So 9 minutes for history, where 6 minutes, then you get a knock. Then 3 minutes, you complete your history in 9 minutes. Then you summarize in 1 minute, so that will be 10 minutes. Then you do the assessment part. So during the assessment, the role player will move off. In the assessment part, you will be talking with the examiner alone, and this will be for another 9 minutes for assessment, developmental assessment. Then once the 9 minutes is over, you get another 3 minutes where you're going, the examiner is going to ask questions to you. So 9 minutes of history, 1 minute of summary, 9 minutes of assessment, and final 3 minutes for viva from the examiner, questions from the examiner. Okay. Okay, doctor, you can start.
Sure. Good afternoon, Mrs. Sarah.
Yeah, doctor, good afternoon.
Sorry, I forgot to write the child name.
My child name is Laya, doctor.
Hmm?
Laya. Laya.
Sorry, say again.
Laya.
Laila.
Laya.
Laia. Okay. I believe you are mother of Laia. Am I right?
Yeah, doctor. Yeah.
Oh, nice to meet you. My name is Shaima. I'm one of the children doctor today.
Yeah, doctor. Yeah.
Uh, could you please tell me what is your main concern with Laia?
Yeah, doctor. I'm concerned that Laya is not able to walk like other kids. She is now 3 years and
Mm-hmm.
is not able to walk. I'm very concerned.
Okay. Mm-hmm. And is this a problem since the beginning, or is it something new?
Yeah, doctor. It was there since a long time.
Okay. Did you seek any medical advice for it before?
Yeah, doctor, we have been showing to the GP, and GP said it will be like that, and he has asked to do the therapies. So
Mm-hmm.
we are going to the speech therapy, then the physiotherapy, and the occupational therapy. So I have been going
So, hmm.
all the therapies.
So you're following up with all of these therapies.
Yeah, yeah,
Yeah.
yeah.
Since when?
Yeah, doctor, since almost 1 year, when Laya was 1 year of age, I've been good.
Mm. Mm. And did you notice any improvements?
Slowly, she's improving with the exercise therapy, doctor. Yeah.
Okay, okay. And is there any medication with the therapy she is taking, other like a long-term medication?
Yeah, doctor, she is having fits. 2 times she had fits. So we are
Hmm.
fits medications, doctor.
How many medications she is taking?
One only, doctor. There's
One
Kepra.
only. And the fits is controlled with this one medication?
Yeah, yeah, fits is
That's
controlled.
good. That's good. When was the last fit?
It was like 2 years back, doctor.
Okay, okay, that's good. Does she receive any recent head trauma?
No, doctor, no head trauma.
Any bugs in her brain?
No, doctor. She didn't have any bug.
Okay, okay, that's good. And did you notice any change in her behavior recently?
Um, no, doctor. She is a good girl.
Mm-hmm,
He
mm-hmm.
doesn't
Okay,
throw any tantrum or anything. He behaves good.
that's good. That's good. How many words can speaking?
Yeah, she can speak quite many words, doctor. She can even put together a sentence, simple sentences.
Like how many words to a
Two,
sentence together?
two words she can put together and talk.
Oh, that's good. That's good. Can she sing a song if
Uh,
she hear a song?
no, doctor. No, doctor.
Okay, okay. Can she tell her name and age?
Yeah, she can tell her name, but
Mm,
age, no, doctor.
age, no. Okay. Is she able to recognize colors?
No, doctor. Colors. No.
Okay. Hmm, is she able to make like obey your orders? If you give her like two orders command, is she able to do it?
Yeah, doctor. Yeah, she does that.
Hmm. How many body parts she can recognize?
She can recognize many body parts, doctor.
Mm. Okay, okay, that's good. And if you give her like opposite, does she understand the opposite?
Opposites, no, doctor. She doesn't
Mm.
that much. She doesn't understand.
Okay, okay. And does she understand negative? Like if you tell her don't do that, is she able to understand that?
No, doctor. Negative, she doesn't understand.
Okay, okay. Okay, I will ask a few questions related to her birth. Was Liam born at date or before her date?
She was born before date, doctor. She was born like
How
I think
many weeks?
32 weeks. She was born.
32. And does she cry immediately after birth?
Yeah, she cried immediately after birth, but she had breathing difficulty and
Mm.
was admitted in ICU actually.
Okay, and how was the course at the ICU? What the doctor told you at that time?
It was a bit long, doctor. She needed almost 5 days for this breathing machine because of the
Mm.
difficulty. Then
Mm.
oxygen for 1 more week, and
Mm.
feeding was there, and almost 2 3 weeks. 3 weeks she was there in ICU.
Mm. Mm. Okay, and does she have any fits at this time?
No, doctor. At that time she didn't have fits. Only later only she developed the fits.
Okay, okay. And what about her screening after birth? Was it normal screening, the baby screening?
Yeah, they did. I think the heel 6 minutes up, doctor. I think they did
Mm.
the heel test and the thyroid test and the hearing test. They were normal. Eyes
Mm.
alone problem was there, doctor. When we followed, she needed even the laser therapy later on.
The?
Laser therapy she needed, doctor, for the eyes. Hello.
Okay, I didn't get this point. I'm sorry, the voice looks interrupted with me.
Some eye surgery was done, doctor.
Eye surgery?
ROP was there. So I
Okay, okay, okay. And do you remember her birth weight?
yeah, she was 1.8 kg, doctor.
Okay. And could you please tell me when her fits started?
It was like 6 months, then
Mm.
1 year, and after that
Okay,
uh, she didn't have any fits, doctor.
okay, okay. Okay. Is there any similar condition in the family?
No, doctor. Nobody else in the family has similar condition.
Mm. Are you and your partner are blood relative?
Uh, no, doctor. I am actually a single mother. I am unmarried.
Mm. Mm.
And
And how you can manage financially?
it's a bit difficult, doctor. Financially, I'm struggling actually.
I'm really sorry to hear that. Do you receive any kind of support at the moment?
No, doctor. At present, I don't have any support, and
Okay, okay. Could you please tell me what is the impact of Layla condition or on your like psychological health,
yeah,
on your social life as well?
yeah, it's very tough, doctor, especially raising a child like this and doing all the therapies. It's kind of
Hmm.
difficult for me to do all.
I'm really sorry to hear about that. Do you have any support around you?
No, doctor, I'm alone actually.
Okay, we'll put this point in consideration, Mrs. Tara. You told me also that Layla had this eye surgery. Any other surgeries that she had?
No, doctor, eye surgery only.
Okay.
Only we did.
Okay. Okay. And does she have any allergy from any food or medication?
No, doctor, no allergies.
Is she up to date to her immunization so far?
Yeah, doctor, I have taken all the jabs.
Okay, that's good. Is Layla going to any nursery?
We have not yet started, doctor, because she is not now walking that well. So
Hmm.
we haven't started.
Okay, okay.
Okay, doctor,
She,
9 minutes up, doctor. Okay.
oh, thank you.
So you can summarize.
So today I talked to Mrs. Sarah, mom of Leila, which is a 3-year-old girl, born preterm at 32 weeks and needed a NICU admission for 2 or 3 weeks. Also, she had a ROB and surgery had done for her eyes at this time. She started to have a fits at 6 months old and was on anticonvulsant therapy, only one treatment, which stopped at 1 year because the fits stopped at 1 year. She's still on one medication for the fits till now. Regarding her speech, oh, I totally forgot the social. Regarding her speech, I will give her age of 2 years old because she can say a sentence of 2 words. She doesn't know any color or she can't do no negative or order commands. I forgot to ask about the speech, so I will skip this part. So I think the reason for her delay is the prematurity and might be also syndrome associated with the fits, like with syndrome.
Okay. Okay, doctor. So 1 minute. You summarized well within 1 minute. So do you want feedback now, or we will do assessment and then we go for the?
The easier for you. Do the easier for you, doctor.
I think better we finish off feedback here.
Okay.
And
Okay.
we will remember so that everyone remembers. Okay.
Okay.
We'll go for the assessment part. So how you did, doctor?
I think it was not good that I forgot the whole social part. I should have assessed the social.
So that's an important thing. So better a paper, better write down.
I put a bit of paper in front of me and I write a speech and social and I even put dressing, feeding, toilet, everything in front of me. And I just went to neonates and postnate and I ignored this part totally. So
Any feedback anybody else wants to give?
Yeah, while asking history, she asked any bugs in the brain. That is something that doesn't sound good, actually. Bugs in the brain. I mean, she could have asked it in some other way. Was any jelly scans of the head done or any sample taken that showed any problem? And
Brain infection, we can tell, no? Brain infection.
yeah, exactly. And she should have asked, explored more about the antenatal part while the mother was pregnant with her. Whether any no questions were asked regarding that part.
Yeah, Shaima.
yes,
See,
that's true.
actually, she was a single mother, so
There could have been issues why the baby was born premature. There could have been reasons that need to be explored.
so antenatal is very important actually.
Yeah.
Especially in MRCP. Now also they gave the scenario of fetal alcohol syndrome.
Drugs and the scans and all of this. Yeah, I missed as well.
Recently, in Hyderabad, fetal alcohol syndrome has come. So unless you ask the history of substance abuse especially now she is an unmarried teenage mother. So age at pregnancy, you could have asked age at pregnancy. So 17 years, 16 years, substance abuse. So all are possible in MRCPCH scenarios. So you should not afford to miss the antenatal history.
Okay.
So then I think as other recommendations, no. So what also they have asked about the preterm complications, so intraventricular hemorrhage. So what?
You could have.
So any investigation was done? I think you didn't ask about the investigations. So at the time,
I try to make it like open question when I say how was the course at the neonatal unit. But yeah, I might say ask it like specific question.
No, the role player may not say the investigations if you do not ask specifically.
If they ask, they will not tell.
Okay.
It's important. So what else, Doctor? Anybody else? Like feeding history. Some more. Once preterm, I think you have to ask some more questions at that time. So that might be the insult point. So breathing difficulty, feeding, then ventilation, then jaundice. So all those things. So plus what happened to the brain scan? Was there any in the jelly scan? Did they talk about any bleeding in the brain? Intraventricular
Okay.
bleeds.
Mm.
These
Okay.
are all going to cause the delay. Okay.
Mm-hmm.
And actually, I kept here one more thing also. She had a history of substance abuse, cocaine ingestion.
Mm.
Really. Then she got rehabilitated and stopped taking it. So that
Okay.
cocaine ingestion,
Okay.
only when you ask in the antenatal history, you will be able to pick up. Okay. And
Okay.
one suggestion, if you are into the ethics, if you have time, so you have to be a bit crisp in your language assessment. You cannot be asking all the questions which you ask in the assessment part. In assessment,
Okay. So, do you think just 2 or 3 question is enough?
yeah, because you have 9 minutes for assessment, but in history,
Mm.
you have to ask so many questions. See, you have to ask about what happened to the hearing. Did you ask
Mm.
about the hearing? Then any special phases, so dysmorphism.
Mm.
So lot of other questions are there. So try to be crisp in your developmental history taking. So maybe 2 questions.
Okay.
See, 2 worded sentence I told her. So what is the age? I think it's 2 years, right?
Mm.
So
Yeah.
why do you want to go much more? So
Okay.
it's delayed. So that much is enough. So
Mm.
if you're able to tell
Okay.
2 years, well and good. Even if you don't tell, no issue. All that is needed is whether it is a global developmental delay or not. For that only you are asked
Mm.
questions in the history for the other domains. You are not
Mm.
expected to tell the age here, but in the assessment you are expected to tell the correct age. So there you will be
Mm.
marked. You will lose the marks if you don't tell the age there. Here, if you tell,
Okay.
it's a bonus. If you don't tell, also not a major issue because time is less. So just assess
Mm.
whether it is delayed or not. Okay.
Mm-hmm.
Try to be a bit shorter. Then you would have had some more time in asking the social history. So maybe 1 or 2 questions in the social you can ask. Okay.
Okay. Thank you so much.
Then allergy and vaccination. If you have time, you ask. If you don't have time, I think that may not add up to your developmental history. Allergies. I think allergies it may not add up. So if you have time, if you are very fast, then okay, fine. You can ask all. If you don't have time, maybe you can skip allergy vaccination. Vaccination also, I don't think it is going to
Mm.
influence development. Not going to influence.
Okay. Yeah, it makes sense. Yeah. Okay.
If you have time, you ask, no problem. Diet,
Mm.
you can see the preterm whether catch up has happened or not. So maybe 1 or 2 questions related to diet you can ask.
Thank you.
So good. So we will move on to the assessment part.
Okay.
Ready?
Yeah, I enter the room, sanitize myself, and first take permission. I'm Dr. Tanushree, one of the doctors here. So can I play with Laya today?
Sure, doctor.
Yeah. Would you like to tell me what is Laya doing right now?
Yeah, Laya is sitting and playing with the toys.
Okay. And how does she look? Is she well nourished? Is she well grown for age?
She is on the lower centiles and head is a bit larger.
Okay, it is a bit large. And does she have any devices around her?
Yeah, she is wearing specs.
Okay.
No other devices.
She's wearing specs. Other than that, no other walking aids?
Yeah, no other walking aids.
Okay, okay. And how does she look? Does she have any unusual features?
No dysmorphism.
No dysmorphic features. Okay, so so I would come to her and try to engage with her. I sit at her level and try to engage with her. I just first I want to see for any color recognition if she has. I would take a toy and ask her to point out. Can you point out which is the red car?
Yeah, she is not able to
Okay,
color recognition.
okay. And when she's playing with her toy, is she focusing well with her eyes?
Yeah, she is focusing well. She
Okay.
is
Okay, so at first I would like to give her some cubes and see what she does with it. So I give her some collection of cubes there. Can she make a tower out of it?
Yeah, once you show,
Yeah, I make a tower. I try to make a tower of about 5 to 10 cubes. Is she able to follow me?
yeah, she is able to make up to 5 cubes. Maybe she can make.
Up to 5 cubes. Okay, okay. Then I take the cubes. While she's holding the cubes, I would like to know how she's holding it. I mean, when she's taking the cubes, I
She
would.
is doing a good pincer grasp, mature
Oh,
pincer.
okay, with good pincher grabs. Is she using both her hands while making the tower?
Yeah, she is right-handed, but
Okay,
she is trying to use both the hands.
okay, but she has a preference for her right hand, right?
Yeah,
Okay,
she is
okay,
preferring for the.
okay. Next, I would like to give her crayons, and I would like to know how she grips it. I would give one crayon from the right and the other one from the left, just to see how she's holding the crayons on both her legs.
She is
What is
she is using both the hands actually to receive.
okay?
And when you are giving it, it's a fist grab. She,
Okay, it's a fisted grip. And what kind of scribbling she's doing? I try to make some write something. Draw some circles and squares. Is she able to follow me?
yeah, she is just scribbling some circular scribbles, maybe some vertical lines. You can put some vertical lines.
Okay, okay. Some vertical lines she's able to make. Fine, fine. So I take out the crayons away. And is it safe for her? Safe for me to introduce a scissor for her? Will the mother allow?
Yes,
Safety scissor, of course.
it's difficult, doctor. She is playing with the scissor.
Okay. And is she able to do anything with it? Make any cuts or anything?
No, no.
No, no. Okay, that's totally fine. And after that, I would like to introduce the board. I mean, is she able to match any? I do the shapes. I try to match and show her. Is she able to match shapes?
Yeah, maybe two simple circle and square.
Okay, up to two shapes she's able to. And what about the beads? Is she able to reel it through?
No, beats she's having difficulty.
Okay, okay. Now I would like to assess her gross motor. I would like to ask the mother, can Laya walk for me, please?
Yeah, she walks well.
Okay, so when she walks, does she have any particular gait?
She's walking a bit stiffly, but she is able to walk.
Does the stance look same on both sides, on the right and left?
Yeah. Stance looks same, but
And
a bit of tiptoe walking she is doing.
okay, and what is the position of her hands when she's walking?
Hands also, uh, it's not a good range of movements.
Okay, okay. So hands, is she keeping it flexed by her side? Is she keeping it?
Yeah, but she's moving. And
She's moving. Okay, okay. And while walking, is she able to walk backward or sideways?
sideways, she's not able to do.
Sideways, she's not able to walk. Okay,
Backward also, she is not able to do.
Okay, okay. So, is she able to run then?
No.
She's not able to run. Okay, okay. And is she able to walk on tiptoes?
Yeah, she is already on tiptoes only.
Okay, okay. She's walking on tiptoes. Okay. If then is she able? If there was a stairs present, if she is she able to climb the stairs? How does she climb the stairs?
She needs to support the rails and climb.
She needs to hold on to the rail and get up. Take each step at a time.
Yeah, with the support, she is able to move. Just
Okay.
like a child, she is going up.
Okay, 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 okay. So she's and this support she needs both while going up and coming down, right?
Yeah, yeah.
Okay. And is she able to use the ball? Can I use the ball? Is she able to throw a ball or catch it?
Yeah, she is able to throw the ball.
And how does she throw it? At shoulder level or above?
At the shoulder level, she is able to throw.
At shoulder level, she's able to throw. Okay. 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 So if I asked her to squat and stand up, is she able to do that?
With support, she is able to stand up.
With support, she's able to do it, not on her own. Okay. Okay. Mm. Mm. Okay, I think I've come to the end of my assessment.
Okay, doctor. Can you summarize your assessment?
Yeah, today I got to play with Leila, and I tried to assess her gross and fine motor skills. In her fine motor skills, I would like to assign an age of around 2 years, 18 months to 2 years, as I could see that she could make a tower of around 5 cubes, and in her in scribbling with crayon, she could make vertical lines and circular scribbles. And other than that, and board, she was able to match two shapes. So this gives her an age of 2 years. And in her gross motor skills, she was in climbing stairs. She needed help both while climbing up and down, which also goes towards the age of around 2 years. And she was not able to walk sidewards or forward, which is again a milestone of 3 years, which she was not able to achieve. So all this makes me come to the conclusion that her gross and both fine motor skills match with the age of around 2 years.
Okay, doctor. So, do you think it's a global delay or isolated?
Since she has delay even in her speech, and both gross and fine motors are delayed, she has a global delay.
Okay. And what's your final diagnosis, doctor? What is the cause?
Probably she has mild spastic diplegia due to prematurity, as she has shown some hand preference, even though it is not very prominent, but she does use her right side more, prefers her right side more. And even while walking, she has a little bit of peculiar gait.
So, what are the other causes for the delay, which can be other than the diplegia? What are the other causes you can attribute?
Other than prematurity and prematurity leading to intraventricular hemorrhage, that can be one of the causes. Other than that, it could be intrauterine infections like toxoplasmosis or CMV. Then it could be also fetal alcohol syndrome, even though there are no particular feces in this child. And we don't know much about the antenatal history in her case. And Other than that, since it was a teenage mother, probably lack of stimulation, lack of proper care can be also a cause of delay in this child.
Okay, doctor. So how do you want to investigate this child?
First, after taking a detailed history, I would like to examine this child, including her hearing and vision, do a complete developmental assessment, check with her red book. And since she's already following a team of doctors, she's doing physiotherapy, occupational therapy, speech therapy. What she requires, I would look into that. What more help she requires? Probably she might require some inputs of an occupational therapy who will help her with some special shoes, which will aid in her walking. And she could require the help of orthopedician if there are any contractures that can also be relieved. And if there is a lot of spasticity, then some medications can help with the inputs of the neurologist, who can prescribe her some baclofen and botulinum toxin if it can help. And she's already undergoing physiotherapy, so that is already been going on. Along with that, I would like to add, she might require some speech and language therapy, as her speech is also delayed. And other than that, social worker can be of help in taking after the emotional needs of the mother, and also helping her with some allowance, which is difficult for her to manage the finances, which she has said. And she's some educational healthcare plan also can be come up, because she's almost 3 years, and soon she would have to go to school. So before that, some plan can be made for her.
What is the role of occupational therapist?
Occupational therapist basically makes the acts of daily living easier for her. Like if she has difficulty in gripping a pen, so special grips can be made by an occupational therapy. Or if there's she has any problem in ambulation at home, though he can help by making some aid, which will help her in her some walking aids, which will help her in her walking. And that is what.
Time of time of. How was it, Dr. Anushri?
I don't know, I'm practicing after a long time actually. After the mocks we had at Chennai, I haven't had any opportunity to practice.
Good attempt. Just maybe major feedback is maybe a bit faster you have to do. So we crossed the 2 minutes.
Okay, we crossed 2 minutes. My assessment was also not within 9 minutes.
Assessment, I think you should complete by 7 minutes. Maybe it went up to 8 minutes. So 1 minute extra. It's tough actually. So to do a fine motor and gross motor, but somehow you
Assessment is 9 minutes, no, sir? And then 3 minutes for.
no. Finally, you have to summarize also. You have to summarize the assessment also. So you
Okay, so
have
so
to
we
finish
have.
the assessment part in 7 minutes. Then you have to summarize your assessment maybe 1 or 2 minutes. Then they will be asking about what are the causes of that delay, how will you investigate, how will you manage.
So
And
it crossed 2 minutes, huh?
just 1.5 minutes plus. Right?
Oh. So how could I have shortened it? Where did I
A bit
waste
faster.
time?
You have to be a bit faster. That's all.
Mm-hmm.
That's all. And anybody else wants to give the feedback?
Time is always the constraint here.
Yeah. So they don't give us the luxury. They could have given a single domain. It would have been easier.
Easier, I know.
But that it's not easier. So let us give two domains. So they give 2 domains. Then we are very much familiar with cubes, crayons, no? So let us
Mhm.
tougher. So they give infant development. So we have to be prepared for all the scenarios. Okay. Then in the message, what all they have given, please share the WhatsApp group link. Yeah, we will. I don't know how to share it in here. I'll share my phone number. You can message me. I'll share the WhatsApp link.
Someone has written the child had a large head.
That's
So
usually, yeah, we can evaluate, but that's how preterms will be. Preterms usually the body will look small and head will look a bit larger. So that's how the preterm appears. But you can evaluate. So I would evaluate for macrocephaly in investigation, you can say. I think Osden has a valid point. Investigation part was missing. Many times you tend to have that feeling. How will you investigate? We talk, no? We tend to bring the multidisciplinary team straight away. So don't bring the multidisciplinary straight away. So talk about the investigation first. So what are all the investigations? So I think the assessment of the other domains. So you can do like that. I would like to complete the assessment of other domains. I would like to complete the neurological examination. I would like to assess the hearing, vision, thyroid. So make sure you talk.
hearing vision, I said, sir. Hearing vision and other domains of development was something I said in one go. Yeah.
Yeah, if you tell that, that would be fine. Then I would like to review the reports. So try to review back the reports. I would look into the seizure was there, no? So I would like to look into the MRI imaging. I would like to look into the EEG, and if something needs to be repeated in discussion with the neurologist, I will repeat the investigations. Okay.
Yeah, genetic investigation should we say in all cases because this child had a
I think here we need not talk
yeah,
about.
exactly. Here we need not say because we
Depending
there
on,
was
depending on the
no
scenario, you can adopt. If you have a syndromic child, then you can bring the genetic evaluation. Okay. But the other reviewing the reports, reviewing the MRI, EEG. So I think those things you can always.
review the red book. I said that will contain all the investigations. I said like that.
Red book has MRI, EEG.
No, it has a complete
Okay.
year of all the investigations and medications, what was done, the total history from birth.
Okay.
So
Okay.
that will have all. That's why I did not specifically say name the investigations. I said
Okay.
I'll review her red book and see what is required.
Okay. Okay.
But can we say like that? That is my question. Is it okay to say like that, or we have to
Yes.
specify?
Usually we talk about a red book for the growth parameters, immunization. I think that part we can use. But when you are specific about MRI, EEG, they will expect actually. You cannot just put, I will do the review the red book. See, we have to get marks for it, no?
Yes, sir. So it's better to specify what investigations I
Better.
particularly want to do. Yeah, because it may have already been done. So you have to review first what
Yes.
has been done.
Yeah. Then the initial hand hygiene you did very well. So just like a examination you are going to do when you are approaching the development station, just like how you approach a clinical station, you are going to do your hand hygiene. You need not introduce because you have already talked to the role player, but you have to take permission to play with the child. Say that I want to play with the child, and then look into the surroundings. What is the child doing? And you looked for the DDDs, so dysmorphism, dimensions. So those parts you did well. So what were the devices? The child had specs. The child didn't have any dysmorphism, so that part was taken care. Then when it came down to behavioral assessment, did you look for any behavioral changes, whether the child is autistic or not?
No, sir. I did not ask for any behavioral
Yeah,
cues. I did not.
that's very important because we might get an autistic child or an ADHD child. So make sure that even for a gross motor also, you might
Yeah,
get
I
because
thought it since it's a gross motor, If it was
We don't
social and cognitive, then I thought I'll ask if it was, but for gross
child
motor,
might be
fine motor,
hyperactive. The child might be hyperactive, as in Fragile X, and you will be given the gross motor, fine motor task. So after you do the hand hygiene, then DDDs, then look for the behavioral, whether the child is showing eye contact with me, whether the child is aloof, whether the child is very much engaged with, obsessed with some toy. So something like that you have to check. Then you have to tell what are all the toys you are picking up. You didn't tell what are the toys you want to pick up for the gross motor and fine motor. So usually there will be a list of items in the table for
okay, we have to name them first or take it as and when the examination assessment goes.
you better mention these are the toys which I will pick up, because there will be toys for the social also. There will be a picture book, there will be a duck, there will be a doll. So you have to tell, I will pick up the cubes, I will pick up the crayons, I will pick up the scissor, book, board, beads. Then I would like to pick up the ball for the gross motor. So you tell, so what are the toys which you are going to pick up. Okay. Then when it came to the thing, you assess the vision. That was a good thing, you assessed the vision. So vision can be assessed by either color matching, but here the child's age is less. So whether the child is fixing at the crayon, whether the child is reaching out for the crayon, so like that you can assess the vision. Then how is the child holding the cube, how is the child holding the crayon, that's very important. Then you try to simulate them. I would stack a cubes. I think you did that, and see how much the child can stack. It's basically a simulation. You're not going to ask, may I know how many cubes the child will make? So don't ask that way. You have to simulate. I would like to make a stack. I will see how many tower the child is able to make like me. So the child is able to make 5 cubes. So like that it will come. So cubes, then crayons, then what is the child drawing? And if the child is able to draw a circle and all, I think you have to demonstrate draw a man. I think maybe you missed, and many often miss the draw a man test when it comes
From
to
3 years onwards, we do a drawman, but this is, you said that the child can only make circular scribbles and
accepted.
vertical line. That is why.
So this child, I think we leave someone who is not able to even draw a circle. I think draw a man is going to be tough. So you need not ask the draw a man because it starts from the 3 years. Accepted. Okay. Then comes the crayon, then the scissor. I think she did well. She asked whether it is safe to give the scissor. Then the examiner will say, no, the child is playing with the scissor. So then don't give the scissor. Then book. Did you ask the book how many pages child is turning?
I missed the book. Even after missing the book, I was late.
Yeah, so that's why a bit faster you do, and how many pages you are able to turn in the book. So that, and there also, I think you did well in assessing the asymmetry. So you give a paper and a crayon and see whether the child is trying to hold with both the hands. Many times you will be given a hemiplegia. So there the child will be holding both with only one hand. The child will reach for the crayon which is nearby. The child will also reach with the same hand for the paper also, even if it is farther away. If the child is able to reach with both the hands for the crayon and the paper, no, so the cross matching, you check whether the child is doing the cross matching well or not. And handedness, but I think for a 3-year old, handedness can come. So handedness is not pathological. So only less than 1.5 years, if the child is having handedness, then that is wrong. So I think 3 years, the child can have some preference with the right hand or left hand. That's okay. But whether the child is trying to hold with the other hand also, you should make sure. So make sure that the child is not weak. I think one more assessment in the initial you can check is related to the spasticity. So how is the tone, whether any scissoring is there or not before entering the um, assessment in the initial part. How maybe you can make him walk and see there. But I think in the gross motor you did that. That's fine, accepted. But at least the tone you could have checked whether the tone is increased. Is it increased in the lower limb or the upper limb? Just a basic assessment we could have done there. Okay. Okay. Then when it
Can we ask these questions about neurological examination? Because tone, power, something is comes under the neurological assessment.
just an assessment of the spasticity alone. So legs are scissoring is there. So something the examiner will say. So that much alone we can tell. We need not go into the detail. Okay. Okay. Now comes the assessment of the age. So whether you have given the right assessment or not, we will check. So what were the things we were discussing? Gross motor, what age you have given?
Gross motor, I gave an age of around 2 years.
Okay. So the child was, what was going in favor of 2 years, you tell me.
He was able to, first of all, walk, and he
So
was
walk,
able to walk. You said on tiptoes. Okay,
walking is 1.5 years, and
walking is 1.5 years.
and
Then
sometimes because of the spasticity they can go tiptoe. So
yes, standing on tiptoes is also he was able to do. So that is also something that comes around two
I
years.
didn't, I didn't say standing on tiptoes. He was always on tiptoes.
Okay.
There's a difference. So he is a spastic child. So he had a tiptoe. So it doesn't mean that he has a good development. He is always on tiptoe. Okay. So that is the problem.
Okay, so he was able to, while climbing stairs, he needed support both while going up as well as coming down. That
So
goes for 2 years.
no,
And
no. How is it 2 years? When someone
it will
needs,
be 18 months to 2 years, sir, the range.
so when someone needs support while climbing upstairs and downstairs, then that will be 1.5 years.
Okay, but regarding throwing the ball, he was able to throw at shoulder level. That is a milestone of around 2 years.
That only I was expecting. So if you are good enough, you have to say, see, in diplegia, which one will be more involved, which one will be less involved.
The legs will be more involved. That is why his use of upper limbs will be.
That discrepancy, if you tell, that would be better. See, upper limb, the capabilities are better. So upper limb, the child is able to throw a ball. So the capability is around 2 years. But lower limb, the child is only able to walk. The child is not able to run. So the child is not able to run. So 2 years gone. The child is not able to climb stairs without support. So again, 2 years gone. Okay. But the tiptoe is because of the spasticity, tiptoe might be there. So don't get away with the tiptoe. So that's why. So the lower limb, I would like to give around 1.5 years. So 1 to 1.5 years. Upper limb, somewhere around 2 years. So that discrepancy is because of the child being diplegia.
Okay.
Even in hemiplegia also, that discrepancy will be there. One hand would be better and the other hand will be less better. So if you're able to give the discrepancy, that would be good. But fine motor, again, it is the hand. So fine motor, I think 2 years. You got 2 years.
Yes, fine motor is two
So
years.
the hands are better. So it came to around 2 years, throwing the ball and cubes and all. But when it came to legs, the child had a difficulty even running. The child was not able to run. So 2 years, the child should run at least stiffly. The child is not able to climb stairs. By 2 years, the child should be able to climb upstairs at least like a child manner at least, but without holding the rails. If the child is able to hold the rails, then that will be 1.5 years.
Okay. With the hand on the rails. He should be at 2 years. He should be able to walk with childlike with one step at each time, but without holding the. Yes,
Yeah.
that is.
So that's subtle. So if you're able to pick that, you will get that 1 mark extra. That's all.
Yes, sir. Thank you, sir.
Then and the investigation the thing only that only. So try to keep investigation support, management separate. Investigation separate, management separate. Bring the multidisciplinary team only in the management part. And when it comes to the causes of the delay, I think you told all very well. So you have to bring lot of other causes that could have contributed for the delay. And in that, actually, in the history, Dr. Shaima actually didn't ask about the compliance in going to the therapy sessions. Here,
Yes, yes.
she had a financial constraints, so that's why she was not able to go to the therapy sessions regularly. So that will also affect, and that you have to address with the social worker. So social worker has to bring in some financial aid to her so that she goes regularly to the therapies. And some other questions. What are the questions? What are the cognitive milestones? So this will be the standard cognitive milestones is the opposite of the motor. So the language and the social will be your cognitive milestones. So if they ask you do a cognitive assessment, then they are expecting you to address the speech and language and the social milestone plus an assessment of the hearing part.
So another question that someone has asked, in a hemiplegic child, that function of one hand will be better than the other. So we will have to say, just to say that there is a discrepancy between the right side and the left side. That the right side is better than that way we can say.
So
But
the problem with hemiplegia is, suppose you are giving, why they have given this task for you. You have to look into that. Why I have been given a task of hemiplegia. So if you are going to give a normal age for the normal hand, why do you even assess? It's going to be normal. No? So that main purpose is to tell that the other hand is having lesser capabilities. So the hemiplegic hand is having lesser capabilities. So better assess both the hands side by side. May not be so detailed, but at least you have to say that the left hand or whichever hand is affected is having lesser capabilities. But developmental age, I think you have to give a single developmental age. You cannot give a child cannot have two developmental ages. Child can have different capabilities of the right hand and the left hand. So that you can say there is a discrepancy in the capabilities of the child with regards to the right and the left because of the hemiplegia. But overall developmental age will be the better one. So you have to give the better developmental age for the child. But at the same time mentioning that the left hand is not that capable. He is only scribbling, he is only drawing some circles and like that. And sometimes there will be another problem with the being handedness. So definitely handed person will have less capabilities on the lesser hand. So that also you have to consider while talking in a hemiplegia. Okay, doctor. So any other doubts? It was a good session, Dr. Tanushree. You participated actively.
thank you, sir.
And thank you all for participating and actively answering Dr. Osden, Dr. Shaima, the previous
Thank you
question.
so much. Thanks for your time. Thank you.
And keep preparing well. And any time, any help you want, you can contact us. And we have our regularly we are doing these sessions. I think Dr. Tanushree knows every weekly at least 2 to 3 sessions we keep doing. So any deeper
Can someone send please the WhatsApp group here so we can join? So,
yeah. So what I will do
thank
is I
you.
will put my number here, so you can message me. I will send you the link. Okay.
Thank you.
Just I think in the YouTube you can search Target MRCPCH Clinical. There we have given the link for the WhatsApp group, so you can search there also. Thank you all. Thank you again.
Thank you, sir. Good night, sir.
Good night.